Vaccinations for hepatitis B, COVID-19, and influenza, among others, are no longer recommended for all children. Nothing bad can happen from what we're doing. Nothing bad can happen.
So the Trump administration is changing the children's vaccine schedule. On Monday, the president signed an executive order that would reduce the total number of immunizations. So basically, instead of 17 shots, which are recommended, it would go down to 11, dividing the vaccine schedule into 3 categories and split the mumps, measles, and rubella shot, known as the MMR vaccine, into individual shots instead of just one. Now, there's little scientific evidence to support these changes. Broad confidence among Americans in vaccines like the MMR shot so far. But for parents, the question this morning is what to believe.
Nothing has changed.
Right.
The science behind vaccines is the same today as it was yesterday. The security that we have with vaccine safety has not changed. The risks that the children in this country face for vaccine-preventable diseases has not changed. And when you have people in the United States in positions of authority that are feeding into confusion and fear, that is doing no service to those parents.
Okay, Dr. Chris Pernell, director of the NAACP Center for Health Equity and Public Health Physician. Thank you so much for being here. So I remember being a new parent, seeing the tray of needles and being like, do we need to do all of these at once? And then the person would explain and say yes. Help us understand why the recommended schedule is what it is.
Sure. Good morning, Audie. I think what's most important for those of us in public health and healthcare is to reassure the public and reassure families and parents that vaccines are safe, vaccines are effective, and that decisions around vaccines should be made by physicians, healthcare providers, and scientists. And those decisions should be informed by years, decades of rigorous research and study. And time again, you've heard other physicians say it, and I will say it clearly this morning. This is settled science. There is no new information that suggests we should change the vaccine schedule.
Okay, well, let me play for you what Trump has to say, Chris, because I think that it's actually quite common to hear this argument that he's making. So let's give people a sample of it and see if they recognize it.
Very simply, large amounts of vaccine, large amounts of like vats of vaccine are currently pumped into your child's body. And I saw this early on, and I've seen proof of it, where they have a vaccination that looks like the size of a bottle of soda poured into a little child's body. And bad things happen in many cases, in too many cases. This is an explosion. This is an epidemic.
Okay, meanwhile, you had Republican Senator Bill Cassidy, who's a doctor, saying this on social media. He says breaking up vaccines will mean children have to get more shots to get the same protection, not fewer shots, and that it will increase hesitancy and make children safe. So help me out, because I'm already confused, right? Like, first I hear we're getting a lower number of shots, then someone says actually it's more shots. Like, what is the difference here?
Yeah, I think it's most important to first say that babies' immune systems are very strong, very smart, and can handle the commonly recommended vaccine schedule. Children are exposed to anywhere from 2,000 to 6,000 immune triggering substances that we call antigens every day. And before this executive order, children were being exposed to 165 antigens through vaccines, which are like beginner books, right? Priming and pumping the immune system to function. So when you change that vaccine schedule, when you break up MMR, or you say that flu or COVID is not recommended, you take the commonly accepted vaccine schedule and you spread it out. What happens when you spread it out? Parents are either more likely to forget and to return for multiple dose vaccines. Children miss much needed protection. And it's not just about the child who doesn't get vaccinated. Remember, immunizations help to perform herd immunity. So it's also about the child or the very vulnerable person who, because of some illness, maybe cannot receive the full recommended vaccine dose. So we have to think about the collective and the whole.
over time, measles, for example, the measles cases are up in the U.S. under this administration. What are your concerns as we head into the school year?
My concerns are that vaccination rate recommended among kindergartners continues to drop. It's recommended to be 95%. It's now 92.5%. And when that rate drops, people unfortunately get harmed, or worst case scenario, they die. We are having the worst measles outbreak in over 3 decades. We are already surging above 2,300 cases in this year alone. And that does not have to be. These are researched, effective vaccines. We know what times are best, we're best able to give the vaccinations to children, and we actually know the best dose. Now we took something that was hardcore science and we demote it to guessing. And for Senator Bill Cassidy, way too little, too late. As a physician, he should have stood his guard before the current secretary actually was confirmed and we were allowed to destroy the faith in public health. This is really, really unfortunate.
Okay, that's Dr. Chris Pernell. Thank you for your point of view. Appreciate that.